Hello, I'm going to talk about Ankyloglossia today. What's Ankyloglossia? It's tongue ties. Yes, that is one of my favorite things to talk about. I spend a good deal of my career, a good deal of my time talking and taking care about Ankyloglossia. In my practice, I see a lot of moms who have difficulties in breastfeeding because their babies have tongue ties. People ask me, how come all of a sudden so many people have tongue ties? How many kids have tongue ties? Everybody's having difficulty breastfeeding. Is it becoming more common? Is it being diagnosed a lot more? Or what's going on there? I am not sure what the exact answer is. But I will tell you, we are seeing a lot of it. We are seeing in my practice, just not in my practice, in random list of patients who I see at the hospital who are not my patients, it's maybe up to 20-25%. That is a very high number. Why are we seeing it so much? I think there are a couple of reasons. Number one, there are more and more people breastfeeding. Hence, they're having difficulties. Hence, they're being diagnosed with tongue ties, and that is the most common cause of problems with breastfeeding. There is a genetic basis too. Have we unraveled the expression of a gene which was not there in the past, which was there in the past, however it was not functionally important? It's not it's not clear. There's a lot of theories, and when there are a lot of theories, we don't have one answer. However, in about the 60s and the 70s up to the 80s, breastfeeding was not very common, or at least it was not encouraged. So a lot of children who would have been breastfed at the time would have failed to thrive, would have not made it, got through the bottle, and now are adults and they're producing children. So is that the reason we're seeing it now? I don't know. Having said that, there are a lot of children and adults who have now undiagnosed tongue ties. In children, what can happen? I see inability to chew, to deal with textures in the mouth. That's probably one of the most common things. Gastroesophageal reflux disease. Problems with dental hygiene and speech. Speech is very, very important. Remember the diagnosis of tongue ties was made, one of the major component was the functional impairment. The functional impairment, one of the most important functions of the tongue is speech. Hence, these two are very commonly seen together. These kids are not able to make sounds like s, t, d, and all the sounds which emanate from the tongue. These kids also have breathing difficulties. SIDS is more common. They are nasal breathers. In adults, there's even more presentations which are as important as obstructive sleep apnea, gastroesophageal reflux disease, TMJ pain, cervical issues, to name just a few, migraines. There are so many issues which come to mind which are dependent on the fascial system, of which one of the expressions is a tongue tie and an upper lip tie. These are the most common presentations that we see in our clinic. In the parents whose children I see when I ask them these questions, invariably mother or father or uncles or aunts, they will say, yeah, we did have these issues. Some of the family members had to have speech therapy, or they have obstructive sleep apnea, or TMJ issues, migraines. We see all of them. Hence, the presentation of it's a whole universe of tongue ties. The presentations can be very variable. Somebody has to think about it. Somebody has to keep that in mind. Remember, I like to say one thing. Your eyes see what your mind knows. If your mind doesn't know it, your eyes are not going to see it. In other words, keep a very high index of suspicion. If you're seeing this whole constellation of symptoms, please look at the tongue, or ask your provider to look at the tongue and the possibility of upper lip tie. I think this is a lot of information that I've given you, but this forms the basis of how I diagnose, what I look around for the symptoms I look for. I think I'm going to have more videos about the issues that we have with breastfeeding. Please write to me about questions that you may have. I will come up with different videos at different times. I'm going to do my best to answer your questions, and I hope this was helpful. Well, that is a lot of information to get and to digest and to process. But remember, what's really important is to keep it on,